changers in European healthcare. Imagine this, you are recovering from a surgery, but instead of going to the hospital every few days, your doctor is monitoring your vitals in a real time from miles away. Picture a system where doctors get an AI-powered alert even before your symptoms become critical. Sounds futuristic? Not anymore. Because across Europe, this is quickly becoming the new normal. The digital transformation of healthcare is a complete overhaul of how care is delivered, managed, and experienced. Hi, I am Mehul Brahmbhatt, CEO and founder of MatrixFlix. I work closely with the organizations driving real digital change, and healthcare is one space where transformation is happening at an incredible pace. Today, I want to walk you through the 5 biggest shifts redefining European healthcare and what they actually mean for providers, patients, and everyone in between. Over the past few years, I have worked with the digital strategy team across industries and I have seen firsthand how hospitals and health systems are making bold, data-driven decisions not just modernize but to humanize care in a digital-first world. Let's break this down into 5 pillars. These aren't just trends, they are structural changes that are setting the foundation for a smarter, more resilient healthcare system across Europe. Private cloud-based electronic health records, EHRs. Let's start with something foundational: data infrastructure. We often hear about cloud-based systems, but hospitals across Europe are increasingly moving to a private cloud, EHRs, and here is why. First, it's about data sovereignty. Health data is sensitive, and keeping it within the organization's infrastructure gives providers a better control. Second, compliance. With the regulations like GDPR, private cloud offer a way to meet a stringent data protection standards without compromising accessibility. Third, it reduces third-party risk and enhances disaster recovery readiness, which is crucial for continuity of care. So, while public cloud works well in many sectors, in healthcare, private cloud brings that added layer of control, security, and peace of mind without sacrificing scalability. AI-driven clinical intelligence. Let's talk about artificial intelligence, not as a hype, but as a powerful clinical ally. AI is helping doctors make faster, more accurate decisions. Here is how. It can analyze real-time patient data to identify early signs of deterioration, often before human hand can detect it. It personalizes treatment plans using predictive analytics, so care isn't just reactive, it's anticipatory. It automates repetitive tasks like charting, documentation, and scheduling, allowing clinicians to focus on what truly matters: patient care. And this is just a beginning. AI is proving to be an incredibly valuable second set of eyes in the healthcare ecosystem. Third, remote monitoring and digital therapeutics. You have probably heard of wearables and mobile health apps, but Europe is taking this to the next level with remote patient monitoring (RPM) and digital therapeutics. Here is what that means in real terms. Patients with chronic conditions like diabetes or heart diseases can now be monitored continuously from home. Doctors can intervene early if something seems off, preventing complications and reducing hospital readmissions. It's a game changer for a rural or undeserved communities where access to a physical care can be limited. Think of it as a bridge between hospitals and home delivering care, even when no one's physically present. Number 4. Cybersecurity in a hyper-connected health ecosystems. Now, with all this connectivity comes a serious responsibility: cybersecurity. Here is a prime target for cyber threats, and digital trust in non-negotiable. That's why European systems are scaling up in a big way, using AI-driven threat detection system to identify risks in real time. Implementing zero trust architecture, which means every device, user, and network interaction is verified. Enforcing end-to-end encryption and multi-factor authentication for a patient data. and integrating continuous compliance monitoring tools to stay aligned with EU healthcare regulations. In short, digital health without digital security is non-starter. They go hand in hand. 5. Big data in population, health and public policy. Finally, let's talk big data. Beyond individual care, data is helping policymakers and healthcare leaders make better decisions at scale. It's identifying trends like rising disease patterns or underserved populations. It's helping hospitals optimize resource allocation from staffing to emergency readiness. And it's enabling more targeted public health interventions that are both proactive and cost-effective. Data isn't just numbers on a screen. It's becoming the foundation for healthier societies. Healthcare in Europe, the bigger picture. Across countries like Germany, Finland, Switzerland, Ireland, Poland, and Sweden, we are seeing a strong push for AI-powered diagnostics, growing investments in a private cloud infrastructure, a wave of healthtech startups driving niche innovations, and crucially, government-led digital health initiative aligned with EU 2030 goals. This isn't future talk anymore. It's happening now. The convergence of AI, cybersecurity, DevOps, and scalable tech architecture is shaping a completely new care experience in Europe. So tell me, what's the one tech advancement you think will have the biggest impact on healthcare over the next 5 years? Is it AI? Is it remote care? Or is it secure data systems? Drop your answer in the comments. I'd love to hear your thoughts. If you found this video useful, feel free to share it with your network. See you in my next video.